going on, guys? It is your girl Kim, and I am back with another video. No, I hate that. What's going on, you lovely, amazing, wonderful people? It's Kimberly Rose here, and I am back with another video. So welcome. Okay, so as you can tell, based on this title, we're gonna be talking about bladder surgery part 2. Yes, my friends, we are going to get into it. We're going to get into it. We're going to get into it. So I hope you ate your food, ate your dinner, breakfast, whatever it is. No, I'm kidding. It's really not going to be that bad. Trust me. But let me just let you know, before you watch this video, if you haven't had a chance to watch part 1, which basically just shows pictures that I took during the bladder surgery experience, go and check that one out. You might want to do that because I'm going to discuss everything that you saw in that video. Moving right along, so before we get started, I just want to take y'all back a little bit and kind of explain why in God's earth would I go through bladder surgery. Because you're probably wondering, what the heck's wrong with her? Why would she need to do this? Oh, trust me, I'll explain. So let me just give you a little background information about me. So if you don't know, I had a spinal cord injury back in 2009, and that resulted in me breaking my C7 level of my spinal cord. And now I am a C7 quadriplegic. See my fingers? Got the proof. So quadriplegic basically means that I have paralysis in my hands and my legs. 4 limbs are affected. After my spinal cord injury, because the spinal cord regulates many different things, but mainly for this video, it regulates the bladder. So because I had an injury to my spine, that affected the way I used the restroom. And so I basically lost bladder control. And so because of that, it kind of spiraled into a lot of different issues. So the first thing, whenever I got hurt, they taught me how to do intermittent cathing, which is basically me using the restroom on a time schedule. And with that, that's basically teaching my body to not leak. Yeah, I wish. I wish it was that simple. So I had a lot of leakage in between. And I have what you call a spastic neurogenic bladder. The leakage was just an issue. It was interfering with my life. So I went to the doctor. I was like, yo, doc, we gotta talk, because this is not working out for me. So he suggested that I try Vesicare, which is medication. I was like, I can do it, okay. So started taking the pill once a day. It worked for about 2 to 3 years, but then again, the leakage came back. So wasn't working for me. So went back to the doctor. I was like, yo, doc, what you got for me? This is just not working for me. So then he was like, yo, let's try Botox. I was like, Botox? That's for your face. I mean, funny. Your girl don't need Botox, not yet. But he was like, no, this is gonna go to your bladder. Trust me, this is something that a lot of people do. It will be really helpful for you. Did the Botox? It took a minute. It did. But then after about a few weeks to a month, I did see improvement in my leakage issues. And so I was like, okay, this will work. It does wear off, so you have to continuously go get it done. And I was doing that, keeping up with going back and getting it done, but the leakage was like stronger than ever. And I was like, yo, I cath. I try to have my body in cathing. There's still leakage. I take medication. There's still leakage. And then I did the Botox. There's still leakage. Doc, what else you got for me? Because this is a problem. And so he was like, why don't we do bladder surgery? And I was like, surgery? Fine, let's do it. You know, I'm down. So that's why I had this bladder surgery. Let's kind of break down the bladder surgery. So the official name of the surgery is the Indiana augmentation cystoplasty. Basically, it does 2 things. It enlarges my bladder, makes it bigger so I can hold more for longer periods of time, and it also reroutes my bladder. So instead of me using the restroom through my urethra, the doctor created a new channel where I use the restroom through my stomach. Yes, I said stomach. Let me just explain to you. A take a part of my intestines and they attach it to my bladder, and that enlarges it basically. That allows it to expand. And out it, and they put a stoma, or a hole basically. They construct the stoma on my stomach, and that new channel is where the urine kind of flows, and I'm able to use the restroom. Now, it doesn't just come out like that. I have to use a catheter, and it's about the same size of a catheter. The hole is pretty small, and I insert the catheter, pee comes out, done deal. The nice part about having the stoma now in my stomach, I can just boop, lift my shirt up, pull my pants down a little bit, and then insert, and I'm done, and it's easy as pie. Great, right? Pre-surgery, what they did was I had to have a bowel washout, so that was in order to prevent infection. Whenever they do cut me open and they get into my bladder, there wouldn't be any possible risk of infection. On a clear liquid diet. 2 days of that, I did that before the surgery. Surgery happened. Surgery went well. Did the little anesthesia. Came back out of surgery about 7 or 8 hours later. I felt okay. So after the surgery, they tell me, okay, we're gonna put you on a NPO diet. So nothing by mouth. You're not gonna eat anything, just to see like how your body adjusts to everything. We're just gonna slowly introduce food to your body again. Whew, that was tough for me. So day 1, it was only food. I mean, it was no food. Day 2, they were like, we're gonna give you some ice chips. I was like, thank you. So ice chips, and then it went to back to clear liquids. Oh, honey, don't give me no more broth forever. And then finally, ding ding, you can eat some regular food. So cool. So that I got through that. That was about 6 days, 5 or 6 days of really not eating much. That's the first battle. What they did during the surgery was they constructed 2 stomas, 2 holes on both sides of me. One was permanent, one was temporary. Follow me now. So the had a bag attached, and that one is called the suprapubic catheter. Meanwhile, while the permanent Indiana cystoplasty hole, that one kind of healed up. It wasn't necessarily ready for a little catheter to go through the hole, so it was just healing basically. Go home, and by this point I'm weak, and my mom got to go back to work, and it's difficult. So had to get a home health nurse. And something else that I had to learn how to do throughout this process, something called irrigating. And so before I left the hospital, they showed me how to irrigate. And basically, that's just washing out your bladder with saline to prevent any infection. So I have the 2 stomas, but I have to now irrigate. Had to get a home health nurse because irrigating was just a part of the process, and I didn't always necessarily have my mother to help me. So when I got home, had the nurse coming in. Went home, had the home health nurse coming, irrigating on a daily basis. Still had the 2 stomas. Not using the permanent stoma yet, but letting the suprapubic catheter drain. So that was about 2 weeks of having these 1 bag attached to me and having the other permanent stoma closed off. They did take out my staples, which was really awesome. I had about 30 staples, so they took them out. They were like, 1 more week, come back. So a week went by, came back. They were like, your bladder still looks good. Let's watch you use your new permanent stoma. Let's watch you put a catheter in there. So it was weird at first, y'all. It was weird, but I was like, all right, I was just brave. So I put it in there, pee came out. They were like, great, you can do it. Now using the permanent stoma, and they tell me, well, we need to build your bladder's tolerance up. We need to build up your bladder to be able to hold large amounts of urine. We don't want you to just go and just hold it for like 12 hours. Your body needs to build up to that. Your bladder does. So they were like, we're gonna put you on a schedule, and we're gonna have you use the restroom every 2 hours for a week. What? Say what? No, every 2 hours. I said that right. You heard me. 2 hours. So I was like, oh God. So I was waking up, setting the timer every 2 hours, waking up, using the restroom every 2 hours, and that was so hard for me. I'm proud to say I am now at about 4.5 hours, which some people might be like, dang, that's not a long time. But hey, I'm grateful. So complications. So let's talk about complications. I did experience some complications from the surgery. Well, I won't say from the surgery. I'll just say there were complications that I did have because I was on bed rest. I'll say that. And because I have a spinal cord injury, I'm at a higher risk than other people. So I did get a blood clot in my right leg. I wasn't really moving a lot, and I'm already pretty sedentary because I'm in a wheelchair, but I really wasn't moving a lot, and that wasn't even recommended. But I think because I was so scared I was gonna like mess something up, I did get a blood clot, and I did have some skin issues as well between my legs. Actually, it did go away, so it's gone. It healed up. It's fine. The blood clot, they put me on medication for my ultrasound last week. Yeah, last week, and pretty much it's gone. They said only a little bit is left. A little bit of residue of the blood clot is left in my ankle. Because you gotta remember that blood clot was in my groin all the way down to my ankle. It was a large blood clot. So they said most of it had dissolved, which I was like, hallelujah. Because it really makes your legs swell a lot. But the complications, I mean, I'm glad that I made it through that. As far as mental health, it can really take a toll, honestly. And I will say I went through a little bit of depression during it. I mean, I'm not gonna lie. I was on bed rest for a while, and I was bed bound, and I was homebound, and I had a home health. I mean, I had a lot of changes really quickly. Just suddenly go from like one way to another. It just really took a toll on me, and it was just unexpected. So if you can make it through the the food trials, if you can make it through complications, if you can make it through learning how to use a new bladder and learning how to use the restroom a different way, if you can make it through just all the changes that kind of come with this surgery, I think you'll be really pleased with the result, honestly. And if I could do it again, I would. Honestly, I would. I was in the car the other day and had to use the bathroom, and I just pulled that shirt up and put that catheter in, honey, while we were driving the car. So it's made a difference in my life, and I'm thankful I had it done. So I hope you leave this video learning more about my surgery experience. And if you're considering having it done, please don't be afraid to contact me. If you just can't relate at all, but you watched the video to support, thanks. If you work in a healthcare setting and you want to teach some of your clients or your patients about my experience, go for it. I encourage you. Please share my video. I made this video to help people, and I really put myself out there, but I knew that during my experience, all I could think about were the people that I would help afterwards. You know, if I said to myself, if I can make it through this, I'm going to share this. I'm going to help somebody else. So I hope you were helped. Thank you for watching. Make sure you subscribe, okay? Talk to y'all soon. Bye.